Any cosmetic surgery that removes skin will leave scars. And this fact is also true for hair transplant surgeries, FUT and FUE hair transplant. But usually all cosmetic surgery procedures give barely imperceptible scars, or the scars are so well concealed they are not visible even to the discerning eye. But there are times when the scars upset a patient, even though minimal, or there are cases in which the scars are markedly pronounced and the patient comes seeking a corrective procedure. So today we discuss FUT scar revision. Revision of visible FUT scars, follicular unit transplantation scars, is a crucial procedure for enhancing aesthesis of previously done hair transplant procedures. FUT, which involves removing a strip of tissue from the back of the head and the sides, always leaves a linear scar, sometimes visible, sometimes not visible. But if you wear your hair short, in more cases than not, it will always be visible. Short hairstyles are in keeping with modern trends of hairstyling. So even small scars, smaller width scars of FUT or even scars of FUE can be visible. And this is despite modern techniques of hair transplant surgery, which aim at minimizing the visibility of scars. Some patients may still continue to be obsessed with a scar which they had never thought would occur. And this brings in disappointment, this brings in regret, and a sense of all-pervasive low self-esteem creeps in. Even when minimal and well hidden, concealed, well camouflaged, scarring can leave a significant psychological mark on the patient. Patients have high expectations from the procedures they think will enhance their aesthesis, give a flawless look. They have not catered for scarring, or they have not been counseled properly. This leaves them feeling deeply self-conscious about any visible imperfection. The psychological impact of scars is multifaceted. The visibility of scar, even if slight, can trigger feelings of self-consciousness, feelings of embarrassment, causing individuals to avoid situations in which the scar could be seen, like swimming, like social interactions. This is due to the fear of judgment. Perceived negative reactions from others can lead to social withdrawal and resultant diminished quality of life. To address these concerns, many methods like trichophytic closure, like advanced FUT and FUE techniques, use of small size punches, are brought into use today to minimize scarring in the first surgery itself. But if the scarring after the surgery is not acceptable to the patient, there are techniques available which can lessen the visibility of the scar. Techniques like trichophytic W-plasty, simple trichophytic closure, scalp micropigmentation, placing FUE grafts into the scar without scar revision offer significant aesthetic improvements which in turn alleviate psychological distress. So what are the three methods that commonly are used to correct FUT scars? Number one, follicular unit transplantation or follicular unit excision, placement of FUE grafts, preferably from the beard, into the scar that is visible. This involves planting beard grafts directly into the scar tissue. Why beard grafts? Because beard grafts are thicker than scalp grafts, and due to the fact that they are thicker, the hair shaft diameter is thicker, the visibility will be reduced much more than by placing scalp grafts instead. However, you have to note that the scar becomes receptive to grafts only after 12 to 18 months when it becomes supple, not before. FUE is more advantageous than other forms of W-plasty, Z-plasty because it does not create a fresh linear scar. A fresh linear scar which will need about 12 to 18 months by itself to heal, to become imperceptible. So the downtime increases by excising the scar. And therefore, if the scar is not too wide, graft implantation by FUE technique is the preferred method. This offers a minimally invasive option to scar revision. The scar visibility can be reduced by up to 60 to 70%, which is a significant amount. And if you add scalp micropigmentation to it anytime after 6 weeks of having implanted these grafts, the visibility is further reduced to up to 95%, which is a lot when you're dealing with scars. And watch today's patient, a patient of FUT scar, not too wide a scar, but the patient is quite distressed and wants some respite from the visibility of the scarring. So a quick glimpse of this procedure today. good camouflage and concealment, we are not removing the scar tissue. Though the scar remains, the psychological impact, the scar in the mind, is significantly improved. So second is trichophytic W-plasty closure, which in this video you will be able to see in greater detail the process of W-plasty, which I first presented some 12 years back, which significantly reduces the visibility of scar by two methods. Number one, by breaking the linear scar into several W components by a method of W-plasty or Z-plasty. And secondly, because the edges of the two wounds after removing of the scar are beveled, this leads to hair growing from one edge to the other through the new scar that forms by the method of trichophytic closure. So by these two techniques, that is number one, reducing the linearity of the scar, and number two, making hair grow through the scar, reduce the visibility much more than a simple trichophytic closure done for scar revision. And thirdly, microneedling. There are several microneedling devices available today which create micro injuries into the newly formed scar tissue, stimulate skin's natural healing process, collagen formation, which in turn softens the scar and reduces the scar's prominence. Mind you, this has to be done only before 12 to 18 months are over, before the scar is not amenable to any treatment but excision. Adding PRP or platelet-rich plasma to microneedling enhances the results of microneedling. Many times in scars which are forming in the first 6 to 12 months, scars which are not very wide, but the patient wants them corrected, PRP as a standalone treatment is quite helpful. And so is carbon dioxide laser. In conclusion, understanding and addressing the psychological impact of scarring is vital to patients' physical and mental health. Healing the mind is as important as healing the scar. It is only when you take both the psychological impact and the physical impact of scar tissue, the aesthetic impact of scar tissue, that you can achieve holistic outcomes, a happy patient. A patient who's confident and returns back to social interactions. But remember that all scars tend to improve over 12 to 18 months. A scar may look very, very prominent at the 6 months mark, but slowly it will subside, become better and more acceptable. Any surgery done before 12 months are over, surgeries aimed at removing the scar through excision, through W-plasty, through trichophytic closure, are not going to help because the body is still modulating the scar tissue. The scar tissue becomes better with time, and therefore any such intervention should wait for 12 to 18 months, and you should not be in a hurry to correct an FUT scar. So that is the talk for the day. Thank you for watching. If you have any questions about hair transplant, about hair loss treatment for men and women, do let me know. Leave a comment in the comment section below and I'll get back to you. If you want a personalized consultation, please leave a message on WhatsApp at the numbers above and we'll get back to you for personalized consultation. Thank you for watching. God bless you.